will be talking about the three bones that make up the pelvis and hip area. The ilium, which is here and here, is the largest bone that is superior to the ischium, which is here, and is an attachment for many of the thigh leg muscles. The ischium forms the inferior part of the pelvis. This bone is posterior and lateral to the pubis bone, which is right here. It is very important for weight bearing in the sitting position. The pubis bone is the smallest and most medial, which are right here. This bone is the thickest of the hip bones, and it articulates right in here in the middle between the two pubis bones, and that's at the midline, and it's called the pubic symphysis joint, and it's a cartilaginous joint. These are the three bones that also make up the actabulum, which is the socket for your hip joint, which is right here and right here on each side. These bones fuse together during puberty. As you can see that there's no obvious spots for a joint, but they do fuse. Our pelvis is also very dense and thick to support the weight of all of our upper body and our limbs and our head, and it fits right about here if you're looking at it on a human. So this is the top ridge right here of my ilium.
The hip joint is a synovial ball and socket joint, and it consists of the acetabulum, which also consists of the iliac, the ilium, and the pubis, and then the femoral head of the femur, and it just sticks in there like that, and it moves around.
Okay, so there are 7 actions in the hip joint. They're extension, flexion, abduction, adduction, lateral rotation, medial rotation, and circumduction. Okay, so first up is hip flexion, which is when you bend the hip joint by moving the thigh or torso anteriorly. And this is also when you decrease the angle of the joint. So this is flexion. And then hip extension is when you straighten the hip joint by moving the thigh or torso posteriorly, which is increasing the angle of the joint. So flexion, extension. And then hip abduction is when you move the thigh laterally, like that. And then adduction is when you move the thigh medially, so back in. And then lateral rotation of the hip is when you rotate the thigh laterally, like that. And then medial rotation of the hip is when you rotate the thigh medially, like that. And then circumduction of the hip is when you rotate the leg from the hip so that the distal end of the leg traces a circle as it moves around. So kind of like that.
So there are 2 main features which stabilize the hip joint. The first of these is the acetabulum being very deep and allowing for the head of the femur to sit deep in the synovial socket and prevent hip dislocations. The second of these is the strong joint capsule which surrounds the joint. The first ligament that makes up this capsule is the iliofemoral joint, and then the second on the anterior side is the pubofemoral ligament, and then on the posterior side we have the ischiofemoral ligament. This helps prevent hyperextension, hyperflexion of the hip.
There are 2 types of hip fractures. There are the femoral neck fracture and the intertrochanteric hip fracture. So the femoral neck fracture is located about 2 inches distal to the ball and socket, and then it involves the neck of the femur. And then the intertrochanteric hip fracture occurs 3 or 4 inches distal to the ball and socket, and it runs right around here, and it involves the lesser trochanter, the greater trochanter, and the intertrochanteric line.